All right, so this is just the agenda. I'm just gonna quick show it to you just before we go on. We're gonna make some introductions quick. I'm actually standing in for Dr. Donald James, who's the director of site. But I'm on this list. My name is Karen Chase. I'm the support consultant for their healthcare programs. If you have any, in my email, you're gonna get a copy of this after we're done, or tomorrow probably. And you can email me with any questions that you have. But we also have on the line, Laura James isn't here tonight either, but we do have Steve. And Steve is a program coordinator. You can email him, ask him questions. He'll help you out. If he can answer it, he can bump it to me if he can't answer it. And then we have Kate Proctor, and Kate is the director of graduate enrollment at Russell Sage College. So,
Grace, nice to meet you.
Nice to meet you.
so a little bit about Site. So, Site is a company that's committed to partnering with universities and colleges to bring quality, affordable programs to people like you, the working healthcare professional, and helping you succeed through those programs. So this program, like I said before, I'm very excited to kind of introduce, because this is a partnership not only with Site and Russell Sage, but also with 1199 SEIU. And the reason why that is exciting is because they're offering a federal grant right now, and to help with the payment of programs that they're kind of finding that there's going to be some nursing shortages or healthcare shortages. So the programs we're going to talk about tonight are not the only programs that are eligible for this grant. But there are many more, and if you go on the 1199 website, you can see what they're there. So the greatest thing about this is, and I'll move to the next slide, is that 1199 SEIU is offering financial assistance. It's pretty much, if you are a member, you qualify for that grant, and that covers tuition, books, all the administrative fees, and what's very exciting is release time to attend classes. So up to 2 days off during the week to help you get through the program and go to all the classes and do your clinical work. So if you're non-union, I don't know, are you a union member?
Yes, I'm a union member.
Excellent. But you can also tell friends and family and whoever else that also non-union members may still qualify for this grant. On this page here, which you'll get a copy of, there are 2 QR codes, and one is for the application for the 1199 members, and one is for the application if you're a non-member.
Okay.
Another great thing about this program is that it's in psych mental health and adult acute gerontology and adult primary gerontology. It's great full-time programs with innovative coursework that's flexible to schedules. Not to say that it's not a rigorous program, it is. But we are going to try to keep you in a cohort model so you can start and finish with the same nurses in a 2-year period, working towards that common goal and supporting each other as a group. So great program. So hopefully you're here because you're interested in either adult gerontology or psych mental health. Because I'm really passionate about the fact of the matter is that why should you go into one of these fields? Well, you probably have your own reasons. Everybody has their own reasons. Maybe professional self-improvement. Maybe you want to earn more, because the NPs do earn more than your basic RN salary. But also there's so many opportunities right now. And, I'm a nurse administrator, and we are seeing so many shortages in these areas. And it's expected the overall employment for nurse practitioners in these specific areas is supposed to exceed 40% in the next 10 years. So it's a huge demand out there. And that's one of the reasons why the union is trying to cover some of these professions that are going to have a huge increase in the number of nurses that we're going to need.
Okay.
I don't know where you work, but you're probably seeing like everybody else, the population's aging, people are living longer. There's more need for people that specialize specifically in gerontology. And also right now in psych, there seems to be not only in adults, but children, a huge increase in the needs of patients needing a psychiatric treatment, counseling, and or only half of them are getting care due to access and lack of access of even physicians in the area. So right now we need gerontology NPs and we need psych mental health NPs to bridge the gap.
Okay.
So application wise, you're going to see, and I'm going to show you what the curriculum looks like. It's 48 credits in 6 semesters. It is a full-time program, and there are 600 clinical hours on that also. What we want you to do is when you go in for your application, you're going to either go to apply for adult primary care nurse practitioner or psych mental health nurse practitioner. The tracks start off the same and then they split up. By the second semester, we're going to have you choose either, once you were in the adult primary care nurse practitioner, you're going to either do adult gero or adult primary care or adult gero acute care. So you'll get to pick that once you're 2 semesters in.
And Karen, I just checked, Marie actually started an application. So
Yes, I did.
Oh,
Yes,
excellent.
yes.
Oh,
Yes.
very excited for that. So I'm also going to tell you a little bit about the application process when we get to what you need.
Okay.
Oh, let's go this way. So these are, and I don't want to sit here and read this to you, and I don't want you to have to read it either, but this is what the programs would look like. Your basic courses when you would take them. The last 2 to 3 semesters is when you will start your clinical work. And you would expect to do up to 1 to 2 days a week, someplace clinically.
Okay.
So I have all the curriculum here. So when we send you this, you can actually look to see what each one of your semesters would look like. So program detail, the program start date is May 19th, 2025. There is rolling admissions up to April 1st. April 1st is when your application is due. Yours is already in there, so good start. The other thing that I want you to know is that they are all due on April 1st, and then there's 2 weeks lag where you have to get all your stuff in. So if you haven't gotten all your stuff there yet, make sure you get that in as fast as possible. Tuition is either you're going to use the grant through the 1199, it's called the Career Pathway Program, or it's still very reasonable if you don't get the grant, so there's only certain positions there for the grant. Hopefully you've started that application process too. But it is still a very, very reasonable program. It's $970 per credit for the 48 credits. And then there's additional course related fees, lab fees and things like that. If you don't use the grant, then we want you to contact Russell Sage to see what financial aid is available for you. So to be eligible, you have to have an unencumbered registered professional nurse license and a minimum of 1 year full-time clinical experience and have a 3.0 GPA in your previous academic achievements. The grant, what's required for the grant is holding an RN license. And with the grant, you have to complete the grant program by the end of spring 2027, which if you look at the calendar, you guys are all start together and then finish together and you'll make that deadline. The other thing is that you have to commit to 3 years of service working in a New York State healthcare provider that serves a patient population that's at least 30% Medicaid. So that is the majority of the hospitals in New York. We do have a list that we can also provide, and we can send that out to you of, there are other agencies that will be looking for you to apply to them too. Some of them are long-term care facilities. There's even some pharmacies on the list. You may actually be working currently in a facility that would qualify for the employment for the next 3 years, so you wouldn't even have to move. You would just apply for that in your own hospital. The other requirements, you've already started the site nursing. You need your official transcript from every place that all your secondary institutions that you went to. You'll need a current resume, 2 letters of recommendation, and a personal essay. So what we're doing is we are advising people to try to have everything together before you start the application, because once you start that application, and it's okay if you didn't, Marie, because once you start that application, you can't get back into it. So a little bit of a system problem, but we do have an email that we want you to send anything else to get to your application. So it's site processing at sage.edu. So anything that you didn't put in that initial thing, we want you to send to site processing at sage.edu. And that will all come together and be part of your application.
Yeah, so Marie, no worries. Your app, came through. It should have said on the application, if you're not uploading now, please send document 2 with that email. So I just took a quick peek. We would be looking for your resume and your personal statement. I didn't see those there. And I didn't see any names listed for letters of recommendation. So I do see that you filled out the enrollment history with those. I think there were 5 places that you have earned college credit, so that's great. We would want to get those transcripts in. But anything extra like those letters, the resume, and the personal statement, you can send directly to that site processing email.
Okay.
Yeah, so that your application was due April 1st, you have that in. Everything else is due 2 weeks after April 1st. It has to be in by then, because May 1st is the decision time. So I'm trying to find my calendar right now to find out what date is 2 weeks from April 1st is.
I think we said the
what?
18th.
I think the
April
18th, yep.
Yep.
The 18th.
Okay.
So
And
everything.
that email address gonna be, you're gonna send that email address back to me, right?
I can put it right in the
Did I write
chat
it?
here if you'd
Okay.
like.
Okay. Yes, please.
Perfect. So a little bit more about the program. Oh, we might have somebody else here. All right, I just admitted Chelsea. Hello, Chelsea. How are you?
I am okay, thank you.
So I started with one person, but what I'm going to do is finish the slides that I'm going through, and then I'm going to go back and answer some questions for you, go over some things with you and then answer. So there were 11 people that signed up today. We only have one that we started with, and then you entered. So I will definitely go back and make sure you get all the information that you need before you leave today.
Thank you.
Okay. So one more time about some parts of the program. It's a hybrid program. It's a cohort. Like I said, we are going to try to keep the groups together for the entire program, just to support. So you develop relationships, you work together for an end goal. I don't know if you've ever been in a program that's a cohort before, but it does really help out. You get to know people. It's just, I find cohorts are especially important when you are doing a lot of remote work and you're not gathering together in a classroom anymore. So it really helps to have a group stay together through this whole process. All of the theory classes are virtual, but most of them are synchronous. So what I mean by synchronous is that the class is scheduled and you get on with the group of students and the professor. There are a couple classes that are asynchronous. Those are ones that you can take when you want, that, you know, the professor the course is online, the professor is not physically there, the students are all taking it at their leisure, but most of these classes are synchronous. There's also an in-person lab and a validation that's required as part of this. The clinicals are on site, and may include some telehealth. And, you should plan to seek out a clinical preceptor that's convenient to you in your location, about a year in advance. Get that nailed down once you start this program. Where are you going to do your clinical rotation? A little bit more information. You have to achieve a B- or better in each course to progress through to the next courses. This is full-time, 2 years. The grant participants must complete by the spring of 2027 to be eligible for the grant. Like we said before, you need 2 letters of recommendations and a personal essay. Rolling admissions, I'll say again, is open until April 1st. We need to get your application in there, but it's April 18th when you have to get all your final stuff in. Your resumes, your 2 letters of recommendations, your personal essays are due 2 weeks after the April 1st, so that's April 18th. The cost is you're going to get full tuition, books, and the administrative fees according to the grant, if you're going to go through the grant, or it's $970 per credit, $46,000, which is very reasonable for this NP program. And Russell Sage does offer financial aid, and that you should call the financial aid officer if you're interested in that. Chelsea, I don't know, since there's only 2 of you, I'm talking a little bit personally to Marie and you now, but are you eligible for the grant? Do you know about the grant? You're on mute.
No, I don't know anything about the grant. I was just coming for information to learn about the program.
Okay, so I will go over I'll go back and I will go over a little bit about that. I just want to see what other slides I have here. All right, these are who we introduced in the beginning. And this is also a QR code. So if you need to apply, you can also use this QR code to apply for the program. I think that's all I have. I'm going to go back so I can answer Marie's question.